patients that come into my practice, you can see that there is a collection of events in their life, possibly traumas, and even stressors. And their perception is blocked. They don't see it. And that's the problem. They don't see it. Some patients will allow me to delve into their past and delve into their history. When I start delving into the past and making that connection, that's where the subconscious brain is very powerful, strong, and a very strong belief system. I can tell when patients are listening and they're are trusting what I have to say. They're opening up where they say, wow, this could be that. And when you change the perception and you change the lens of why they're getting headaches, not on a structural level of just headache and a pill, they see that their headaches are coming from something larger, some trauma that's suppressed or repressed, then that's when you make that connection. And when you take it out of your subconscious and you bring it into consciousness and you become aware of why you're feeling a certain way, that is the first step into healing. I had a patient who's suffering from chronic headaches. She receives Botox for her chronic migraines. Her headaches have decreased in frequency and severity related to the injections. On the other hand, she still has migraines. She still gets headaches. And when you take a history from her, she was sexually abused when she was younger. She had a very tough childhood, and she likely was suffering from emotional trauma and headaches when she was younger that has persisted. So how is a Botox going to help that? No, it's going to alleviate the pain. It's not going to help the connection and tackling the emotional trauma that's suppressed or repressed. Take a whole entire history of the patient. The patient has a narrative. What is your patient's narrative? What's the narrator in their head talking? How do I change that narrator? This narrator is saying something with words that are negative, these beliefs that are sabotaging themselves, is causing them to feel victimized, causing them to have more pain, causing more to have inflammation in their body, causing them to increase the risk of developing more migraines, then that is a connection of why you're developing that. I have trouble sometimes communicating with my patients when I tell them these things, because it sounds like, doctor, you're not empathizing with my symptoms. You think this is all in my head, or you think I'm crazy. And the thing is that I don't think you're crazy. It is somewhat in your head. It's authentic. It's real pain. It's real headaches. You feel the headaches. The question is, why are you getting headaches? A lot of people don't get headaches at all. Why do you get headaches? Why am I suffering from headaches that someone else doesn't suffer? Why am I victimized from headaches? Well, let's get into it more than just giving you medication and relieving that headache, because chronic headaches and migraines is really a chronic dysregulation of emotional health, plus habitual behaviors that interfere with your sleep, interfere with your diet, your exercise, and the way you relieve stress and tension. So when I talk to my patients and I tap into their beliefs and I tap into their exercise, their sleep, the way they handle emotion, a lot of my patients are telling me that I exercise every day, which they look great, they're fit. I eat healthy, but I'm still getting headaches. They missed that pillar, the emotional health part. And I said, how about your emotional health? Well, I don't really have any stress in my life. Well, yes, it's not the stress in your life. It's the way you respond to stress in your life. Or all those programs of your brain that are stored, that subconscious is storing, that is causing you to feel pain. That is the problem. That is generating headaches. And a lot of times my patients also are saying that my mom or dad had headaches because they're patterning their headaches also the way their parents dealt with stressors. They're getting headaches too because they saw mom and dad suffering from headaches. So it's not just coming in here and saying, take a medication, you're going to feel better. It's going through this whole process of looking at all the layers. Then I have patients say, I meditate every day, and I ask them how they meditate. And they say, well, I listen to apps and it doesn't help. Well, yes, they are meditating. That's a great start because they're meditating briefly. It makes them feel better, but they go back to their habitual patterns of how they handle the emotional stressors and tension throughout the day. And then I have patients say, I'm not that type of person to meditate. Can't see myself meditating. You have a prefrontal cortex that is looking in the future and is worrying. And it's constantly planning for the future. And then you have this emotional brain here and the prefrontal cortex in a constant paradox. Clearing the brain and clearing it in a certain state of mind is not going to help. Meditation can help, but it's not the whole problem. And our patients can't see it. That's the problem. Or they feel like they have no stressors in their life. We all have stressors in our life. Some, unfortunately, have more stressors in their life. Unfortunately, some people go through divorce, go through a very bad move, parents dying or something tragic occurring, and they get harbored and these emotions get stored and they do come out in the body. And they can't come and present as headaches. So when patients come see me and I'm looking at them and I say, look, you have headaches. Let's treat the headaches. Let's go dig deeper. Sometimes I get resistance because either they don't want to talk about their trauma or they feel like it's far-fetched because the traditional role of a doctor is to heal and treat the patient's symptoms and make them feel better on that level. So a patient wants to come in. Traditionally, they're used to a doctor prescribing them a medication, giving them an injection, giving them a treatment, or an MRI, and then they feel better for a period of time. Traditional doctors do that. That's the way I was trained. I was trained to see a patient, give a medication, and wish the best. And then the patients would come back and they would continue to suffer from migraines, from headaches. Patients want to be listened to. They want to be heard. They want to be understood. It's just, they want you to hear the words. And if you don't hear the words that I'm suffering, I'm concerned, I'm fearful, I'm worried, then you're not listening, understanding, or empathizing. I just went through the 5 pillars and I told them they have emotional dysregulation and they have to work on emotional health and they have to look at their subconscious. And I have to tell the patients that they have to eat correctly, diet, exercise. They're going to say this doctor's a wackadoo. What is this doctor? I'm coming to see a traditional neurologist and I'm not getting a prescription. What is going on here? I'll prescribe a medication. Of course, I use it in practice. They work. The thing is, when the medication stops working or it's not working, then I get into those pillars as well. I have had cured patients that I was able to connect a trauma experience with them to their headaches with medication or without medication, and then going through the pillars of health, cured migraines and do extremely well without that medication. There's an expectation that the doctor is going to prescribe something like an MRI and a medication, which I do in my practice. The expectation is to get a medication and to feel better. In order to feel better, you have to connect all those 5 pillars. And I spend a lot of time listening to my patients and making that connection. Once you make that connection and you bring it out of your subconscious into the level of consciousness, that is the start and the beginning of healing. They're not just a patient. They're a person. They fill out their paperwork. They're waiting a long time. You want to get to know your patient. And that's why when you start getting to know your patient, not just my patient has migraine and suffering from headaches and is stressed out. That's not something that I would like to do in my practice. And that's why I changed my practice. I want to hear their stories. I want to hear the traumas or experiences they've had. I want to hear their jobs. I want to hear their life and work balance. I want to hear any stressors in their life. I want to hear what they're eating. I want to hear their exercise program. All of these things are part of the whole person. It's not just a patient that walking in. It's a person that has emotions, a person's not feeling well. And I want people to start learning in medicine, it's not just the physical health aspect of it. The emotional health aspect of it is so ignored because number one, patients don't see it or we don't see it. So our perception is not there. That's number one. And number two, is ignored because the people that are trained, whether they're psychologists or psychiatrists for the most part, they're trained more for medication or psychologists more for traditional cognitive behavioral therapy or talk therapy. So one of the reasons why I'm doing the podcast is because patients don't have access to mental health providers. You can see that it takes so much time to really understand that there's a patient, but not only is a patient, there's a sequence of events, of patterns, behaviors before the age of 7 that is program downloaded traumas that they've experienced before and through their whole entire life, and all of their stressors, which leads to all of this part of their bodies being dysregulated. Sleep, stressors, diet, exercise, physically. There's just so much that goes on in the patients that they get lost in the system, because as patients, they go right over towards the physical health aspect of it and want to feel better. Let's back up a little bit and let's look at the emotional aspect of it, because that is a huge layer, a huge factor or component of your physical health.